Hello, everyone, and welcome. It's Nurse Eunice with Florida Training Academy. And in this video, we're going to be discussing medical terminology. So get your pens, get your paper. If you are in the comment area and you want to answer the questions, you are more than welcome to do so. And again, we'll get started in a few moments. We start in about 10 seconds to give everyone time to receive their notifications. And good evening. During this live stream, I will not be monitoring the chat as frequently, but you're welcome to put your comments in the chat. So here we have the abbreviation, which is an A symbol with a circle around it. This represents at. The pound sign represents exactly that. It is number or pound. ABD is short for abdomen. The abbreviation AC means before meals. The abbreviation ADL stands for activities of daily living. Ad lib is as desired. An example would be that your resident can ambulate ad lib, which means they can get up and walk whenever they feel like it. AMB is short for ambulate. AMT is the abbreviation for amount, and every facility has their approved list of abbreviations. So when in doubt about whether or not an abbreviation can be used in your facility, please check with your charge nurse or medical director. This one's easy. Approx is the abbreviation for approximate. As TOL. As TOL is an abbreviation for as tolerated. AX, AX, is a medical abbreviation for axillary, which is referring to the armpit area whenever we're taking a temperature. So you'd be taking an axillary temperature. BID is another medical abbreviation. BID stands for twice a day. BKA, you'll see this term oftentimes if a person has had a severe wound or if they have uncontrolled diabetes, and as a result, they may end up with a below the knee amputation. BM could mean one of two different things. The most common abbreviation is bowel movement. However, sometimes whenever your providers are writing notes, they may also use BM to indicate black male, as in the race and the sex of a patient, black male. BP, blood pressure. BRP is the medical abbreviation for bathroom privileges. So that could be an activity order. If your patient has bathroom privileges, they would be able to walk to the bathroom. They would not need a bedpan in most instances, nor a bedside commode. BR is the medical abbreviation for Bed rest in most facilities, but it could also mean bathroom. So if it's an activity order and it says BR, that means that your resident's on bed rest. Please make sure that when you get your supplies that you also bring in a bedpan, because when someone's on bed rest, they usually can't get up and ambulate and go to a bathroom. CC refers to liquids. So if a person voided 400 cc's, the real term is cubic centimeters. So it's how many cc's, how much fluid came out of their body. C/O, complaint of. Mr. Henry complained of chest pain. So Mr. Henry C/O, chest pain. CA is usually a medical diagnosis. And so CA stands for cancer. C/S is a procedure that you'd have to perform sometimes, and that will be culture and sensitivity. So we will have you collect the urine, collect the fecal matter, so we can send it to lab for a culture and sensitivity, so we can find out what's growing inside of the body fluids. Cath is an abbreviation for the word catheter. CHF is a medical abbreviation for congestive heart failure. This is an easy one. CNA is a medical abbreviation for the person who assists the nurse and also assists the residents and the patients. And that term is certified nursing assistant. CO2, carbon dioxide. So when your patient is hyperventilating, sometimes they are retaining CO2. So we want to try to get them to slow their breaths. COPD is short for chronic obstructive pulmonary disease, which is a chronic respiratory condition. CPR is the abbreviation for cardiopulmonary resuscitation. That's the life-sustaining skills you'll provide when your patient or resident is in cardiac arrest. It consists of chest compressions followed by rescue breaths. CRT is the abbreviation for capillary refill time. CVA is the abbreviation for cerebral vascular accident, which is another term for a stroke. D/C is what you'll see in the medical record whenever you have an order to discontinue a treatment. So maybe there's a medical order for the nurse to DC the IV. D/D, developmentally disabled. DM is the abbreviation for diabetes mellitus. DNR is the medical abbreviation for do not resuscitate. DOA is not a term you're going to hear often, but DOA refers to dead on arrival. So that is something, if you're a first responder, paramedic, that's a term that they would probably use more so than a person who works in a facility. DOB, date of birth. You have to verify your patient's identity using two identifiers. One could be their name. The second, you would ask them their date of birth. DOE is the abbreviation for dyspnea on exertion. In other words, whenever your patient exerts, whenever they start to move about, they become short of breath. DQ is not a common abbreviation. However, it means decubitus ulcer. DRSG is short for dressing. So your patient could have a wound care order that requires the dressing to be changed once per day. DR is short for doctor. DX is the medical abbreviation for diagnosis. It's the reason that your patient is admitted to the hospital. ECG/EKG, the term that's used is basically just depends on what part of the world you live in. We say EKG in the US, but technically it is ECG. It's electrocardiogram, or it's a diagnostic tool used to look at the electrical activity of the heart. EEG is the medical abbreviation for electroencephalogram. So we usually have EEGs performed to monitor the brain activity. If a person has had a stroke, usually a stroke or a seizure, the provider will order an EEG. ET is the abbreviation for and. ETOH is the abbreviation for alcohol. So if someone has a history of alcohol dependence, you'll usually see it listed as ETOH abuse. F is the medical abbreviation for Fahrenheit. FH is the medical abbreviation for family history. Foley, we don't consider it a real abbreviation, but it's kind of a common name for a indwelling urinary catheter. However, Foley is just a brand name. There are multiple different types or brands of indwelling urinary catheters. It just seems that the most common term that sticks is Foley catheter. FU stands for follow up. The patient is to follow up with his physician after discharge. FUO is fever of unknown origin. So after we've collected all of those specimens and we can't find the source of the infection, the person may have something listed on their chart that says fever of unknown origin, or FUO. FWB, full weight bearing. FX is the medical abbreviation for fracture. GI is the medical abbreviation for gastrointestinal. GTT is the medical abbreviation for drops. H/HR is the medical abbreviation for hour, as in hour of time. HOB is the medical abbreviation for head of bed. Elevate the patient's HOB to 30 degrees. So that would be a semi-reclining or a semi-Fowler's position. HOH means that your resident is hard of hearing. HS, whether it is lower or uppercase, means hour of sleep. Your diabetic patients may have an order for an HS blood sugar check and an HS snack to make sure their sugars don't drop while they're sleeping. HT is the medical abbreviation for height. HTN is the medical abbreviation for hypertension. That is when a systolic blood pressure, the top number is greater than 140, and the diastolic or the bottom blood pressure is greater than 80. HX is history. What is your patient's medical history? Such as, did they have a history of cancer, cardiovascular disease? I and O stands for intake and output. What goes in should match what comes out. So if your patient drank 2 cups of water for breakfast, about 2 hours later when they void, when they urinate, we want to see the equivalent amount of urine come out. So this is how we maintain our patients' fluid balances, by monitoring their intake and output. IDDM is a medical diagnosis, which means that your resident has insulin-dependent diabetes mellitus. Not every resident who has diabetes requires insulin. NIDDM means that your resident has diabetes, however, they are non-insulin dependent. So it's non-insulin dependent diabetes mellitus. They are controlling their diabetes, their blood sugar levels via oral medications and diet and exercise. IM is the medical abbreviation for intramuscular. IV is the medical abbreviation for intravenous. kg means kilograms. Capital L is the abbreviation for liter. Lab is actually short for laboratory. LB is the medical abbreviation for pound. LIQ, think of those who would be administering medications. So LIQ is an abbreviation which means liquid. LOC is very important. LOC stands for level of consciousness. So if your patient is not as responsive as they once were, we would say they had decreased LOC, which is a medical emergency. LPN stands for licensed practical nurse. LPNs usually go to school for about a year to a year and a half. They are able to provide wound care, give medications, do secondary assessments. However, they usually are not the ones who do the primary assessments, the first assessment on the patient, and they may or may not be able to start IVs. So if you are interested in going from CNA to RN, also look at the CNA to LPN track. LT is the medical abbreviation for left. And notice that the L was capitalized. So capital L, lowercase t is left. MD is another way of saying doctor or medical doctor. MI is a medical diagnosis that means myocardial infarction, or the simple term is heart attack. The abbreviation MR stands for mentally retarded, and this is not a term that is commonly used in the United States because it is degrading. So we may use developmentally disabled over MR. Na stands for sodium. So think of your elemental table. Na is sodium. NAS is a diet type. When a person has cardiovascular disease that is severe, their diet may say NAS or no added salt. So you could not put salt packets on their tray. NCS is the medical abbreviation for no concentrated sweets. A diabetic should not have concentrated sweets. So you may see a diet order that also says NCS for a diabetic resident. NG is short for nasogastric, such as the tube that is inserted from the nose down into the stomach that helps to decompress the stomach, particularly in patients who've been vomiting. NKA. You want to check this every patient every day. You want to check their allergies. So NKA stands for no known allergies. NOC or NOCT, think nocturnal, so nighttime. NPO is nothing by mouth. NWB is non-weight bearing. So a patient after a hip surgery or a major orthopedic surgery may have an order for one or two of their extremities to be NWB, non-weight bearing. NS is the abbreviation for normal saline, which is the main fluid we use to rehydrate the patients. OOB is the medical abbreviation for out of bed. So your patient may have an order for OOB with assist. That means that you would have to physically support and assist them to get out of the bed and into the chair. OZ refers to fluids, and that's the abbreviation for ounce. PT is the abbreviation for physical therapy or physical therapist, the person who provides the therapy services. PC is another term related to diabetic patients. PC stands for after meals. So your patient, especially if they are a brittle diabetic, they may have orders for glucometer or blood sugar checks, AC, PC, and HS. Per equals by or through. PO is by mouth. PRN, when necessary or as needed. PT is the medical abbreviation for patient. PWB, partial weight bearing. Q is the medical abbreviation for every. So your patient is turned Q2H every 2 hours. And here's another example, Q2H, as I just stated, every 2 hours. QD, every day. QH, I think you're getting it now, is every hour. QID, whether it's lowercase or capitalized, means 4 times a day. QOD is Q is every, O is other. D is day. So every other day. And I'm realizing that all of my slides did not load, and I do apologize because that was only 200 slides. So I will come back again tomorrow and show the rest of the slides. So again, this is Nurse Eunice with Florida Training Academy. We have over another 100 medical abbreviations to go. So I'm just not sure what happened to the presentation, but I will get those slides back up shortly. So everyone, enjoy the rest of your holiday, and I will see you in the next video.